Hello everyone, I'm Dr. Mukai from Alps Dental. In our last episode, we talked about soft artificial teeth, how they naturally wear in and adapt to the inside of your mouth. Today, we continue from there. Actually, soft artificial teeth have one more very important feature. That is their cushioning properties. Here, I'd like to briefly explain how dentures work. Dentures are placed on top of the gums. Beneath them lies the jawbone. However, when you bite, the greatest stress is borne not by the denture or the bone, but by the mucous membrane trapped between them. Between the hard denture and the hard bone, that membrane gets compressed. That is when pain occurs. In a sense, the denture rests on the jawbone on a soft cushion of mucous membrane, like sitting on a zabuton floor cushion. This membrane is supported from within by blood flow, maintaining a soft, cushiony thickness. However, this membrane too gradually weakens with age. For example, as heart function declines and blood vessels harden, blood circulation worsens. The cushioning of the membrane also becomes more vulnerable to pressure as a result. Furthermore, as the body thins with age and the membrane grows thinner, bone shapes that were previously hidden can begin to cause pain when pressed or bitten. The topic for today is the slightly soft artificial teeth we have been discussing since last time. These have a slight cushioning effect as you would expect from something soft. The moment you bite, they cut through food while deforming ever so slightly, compressing just a little and absorbing a small amount of the impact. In other words, they offer the gum's mucous membrane a measure of protection against the intense pressure of biting force. As a result, pain is less likely to occur. Less pain means fewer visits asking for adjustments because it hurts. In fact, I once had a patient at our clinic who simply could not get rid of the pain. The denture fit well. The bite showed no problem. Yet, no matter how many adjustments were made, biting was still painful. When I palpated the painful area, within the mucous membrane, I could feel something hard beneath the surface. So I took a CT scan to investigate. And here is what we found. You can see that the bone has a sharp, pointed shape. When the bone itself has this kind of problem, pain inevitably occurs every time the denture presses on it. This patient underwent alveoloplasty to smooth out those sharp edges, and the pain that had persisted so stubbornly disappeared completely. In other words, denture pain is not always caused by the denture alone. The shape of the bone can also be the cause. That is precisely why softening the impact of biting even slightly carries great significance. I had always wanted to make dentures so natural that no one could tell they were dentures, and to have patients use them for a long time. But achieving that used to take considerable time. However, with these soft artificial teeth, patients adapt to their dentures much more quickly. They experience far less pain. Admittedly, wear does occur faster, so they cannot be used as long. The general guideline is replacement every 1 to 2 years. But because they are soft, they reduce pain and make adaptation easier. One downside is that these artificial teeth have a connected structure, which limits fine adjustments to tooth alignment. In other words, for those who want precisely crafted, beautiful alignment, this option is not suitable. So, a hard, long-lasting denture with freely customizable alignment, or these soft teeth. It is not a question of which is better. The range of choices has expanded. That is what I believe makes these teeth truly valuable. Next time, we will cover the many confusing aspects of full dentures, things that are hard to understand and leave people unsure. If you found this helpful, please be sure to watch the next episode as well. Thank you very much for watching.